Let's move on to the issue of aged care now. And, of course, a Royal Commission is underway, has been underway this year into aged care in this country. I'm joined now by Ian Henschke, who heads up National Seniors Australia. Ian, thanks for joining us again. Give us an update as to where the Royal Commission's at and what's happening today with hearings.
Well, Chris, today's a very interesting session, a packed courtroom in Brisbane where they're looking at some of the events around the Earl Haven closure. Now, you might remember that was really only a few weeks ago, and various people are being put on the stand there and being questioned about the relationships, the way that they were wanting to be paid, various letters, emails going backwards and forwards. But it highlights the problem that you can see where if a centre can't be assured of getting its money from a sort of a subcontract that was in there, then you end up with a situation where people are actually, they dialed, I think, 000 in the end, and people were put in ambulances and taken away. And it's just completely unsatisfactory. So the Royal Commission's looking into the events surrounding that. And also other events that will be on today will be some of the discussions about people who are very concerned about what happened to their parents. In one case, a daughter will be talking about what happened with her mother, who went into an aged care home, and shortly afterwards she was dead. I mean, she only lasted 3 months, and she said she went in there walking in, and very shortly after she died. And these are some of the concerns that people have. Also, some of the issues surrounding one of the providers there that's had a string of problems, and I think the latest figures show that there are dozens of providers that are in trouble in New South Wales. So, look, this is a really good opportunity for some really forensic work to be done and to come up with some solutions. And well, I think I said to you once before... go on, Chris.
This Earl Haven incident or episode, let's just focus on that for a moment. It was on the Gold Coast, as you say. It suddenly shut its doors last month, and 68 residents just had nowhere to go. And as you say, people had to dial 000 to try and find a place for them. Apparently there have been warnings about the operations of this centre for some time, and it was able just to suddenly shut and basically turf the people in aged care out onto the streets. So I mean, there has to be some sort of management system, doesn't there, if an aged care centre is going to close down. It can't just shut its doors overnight.
Well, this was an argument between, if you like, someone who was subcontracted to actually run the aged care side of it, and they said they wanted $3 million. They put in a letter of demand, and they said if they didn't get that, they couldn't continue to operate. But look, the actual evidence is being discussed at the moment, and they will get to the bottom of it. But I do find it very interesting that we do hear from providers that they require more money. They say, look, it's all about money. But at the end of the day, this is taxpayers' money. It's being provided by the federal government, and we need to have better control over how it's being spent. It's vast amounts of money. In total, the aged care budget is now predicted to be above $20 billion, I think, the latest. The bulk of that goes on residential care, and these aged care facilities are being given money from the government, from the taxpayers, and I think it's great that the Royal Commission is doing some forensic investigations into how that money's being spent and how it's being spent in some cases so that the residents don't appear to be getting the benefit from it. So it is a really important Royal Commission, and it's an opportunity to set things right. I think I mentioned that once before that when they looked at home care, we heard a figure by the department where it said that it would require another $2 billion to go into home care to fix the problems there. There are some people that say that the residential care is a separate issue. So you've actually got two strands of what the Royal Commission is looking at. It's looking at home care, it's looking at residential care. You've also got other packages that are provided by the Commonwealth. And look, there's a lot of work to be done, and the findings will be handed down in October, the first set of findings, and then the final report will be in April next year. So, and I'm glad that it's starting to get some coverage. I was a bit worried there because for a while there it seems to have just been pushed off the radar. So I really appreciate the fact that you're discussing it today, Chris, because this is an important Royal Commission.
There are a couple of key aspects here. One, of course, is the cost, where government money goes, how much it costs patients going into aged care, and whether all that money is used effectively enough. But another critical aspect is quality control. You raise instances of where people go in and their health deteriorates or they die quickly. There's big issues there as to whether family and other carers actually are vigilant enough, visiting people enough, watching what sort of care goes on. But who ultimately is responsible for quality control about the care in aged care homes? Because there seems to be an awful amount of overlap between state and federal government authorities and of course, private sector operations.
Well, ultimately, the buck stops with the federal government. I mean, the Aged Care Act of 1997, which was updated some time ago, states quite clearly that the job of the Commonwealth is to provide the funds to provide adequate care. Now, we had the Elder Abuse Conference in Brisbane only a week or so ago, and the Act was discussed there, and people said, well, look, ultimately you can't legislate quality of care. You can actually suggest this is what people want, and that's what people do actually want. But you do need people to go in and carry out that inspection.
Yeah,
now,
you need people at the coal front, dropping in unannounced. Yeah. And historically, we know that federal governments are not good at that. I mean, state governments struggle enough, but at least state governments are closer to the facilities, closer to their communities, and are more likely to be able to deliver that sort of scrutiny.
Well, the aged care minister, the previous aged care minister, decided to put a new commissioner in place, and that was done on the 1st of January. There has been a lot more scrutiny of aged care facilities, as they want to call them. I like to call them aged care homes because I'd like to think that people are living in a home, not a facility. But there has been a lot more scrutiny there. And National Seniors was calling last year, and we've been calling for a long time, for unannounced visits. Well, we're very pleased that that's actually happening. Yep. You'll hear two sides of the story here. You'll hear the providers saying that some of the things that they're failing for are minor issues, and therefore you need to look more carefully at what's going on. But then some of them are major issues. I mean, the most difficult of all is the fact that the vast number of people who are living in aged care have some form of cognitive problem. We know that Dementia Australia says more than 50% have dementia. There's a lot of undiagnosed dementia there as well. And guess what, Chris? There is no mandatory training that is of the people that are actually working there. That's only just been adjusted recently so that new aged care workers have to do some component of dementia training. Now, that's something that National Seniors mentioned on the very first day of the Royal Commission. So there is some action taking place. But I don't think it's appropriate that we have workers working in aged care who are not trained in dementia. And if they're working there now, they should be trained. And I think that the onus is on the federal government, because they're there to provide the quality of care, is to make sure that those people do get proper training. And that's something that should be done immediately. We don't have to wait for the end of the Royal Commission to actually say that we need proper training in our aged care homes. Indeed.